Afternoon, class. My name is Crystal Jennings.
And my name is Nicole Brady.
Today we will be lecturing on standard and isolation precautions, as well as the use of personal protective equipment, also known as PPE. Isolation precautions creates barriers between people and germs. As healthcare professionals, it's important that you protect yourself, your patient, and visitors from the spread of infection. The goal of this presentation is to teach you, the learner, ways to prevent the transmission of microorganisms from infected patients to other patients and hospital visitors. The objectives of this presentation is the learner will list 3 types of isolations, precautions, and indications for use.
The learner will also demonstrate proper hand washing technique. The learner will review and explain basic requirements for standard precautions. And the learner will demonstrate the proper sequence for putting on personal protective equipment, also known as PPE, and the safe removal of that personal protective equipment. Now we will be discussing isolation precautions. Isolation precautions are the practice that prevents transmission of germs from patient to staff and from staff to other patients. However, it is not only limited to patient and staff, but also to any hospital visitors that may come into the hospital setting. Types of isolation are determined by how a disease is transmitted.
One type of isolation is airborne precaution. This applies to diseases transmitted by the airborne route. Viruses and bacteria are released when a patient talks, coughs, or sneezes. These droplets float on air currents and remain in the air for long periods of time. A susceptible person who does not wear the proper respiratory protection has the potential to inhale these droplets and become infected.
Some diseases requiring airborne precaution are the following: pulmonary tuberculosis, measles, chickenpox, viral hemorrhagic fever, and the one that is heard most today, mostly on the news, is Ebola. Some special masks may be worn depending on the severity of the disease. For example, in cases of tuberculosis or TB, an N95 mask must be worn and the patient must be placed into a negative pressure room and the door must remain closed at all times. Here we have a picture of the N95 mask. This mask will be provided by the health care facility you work because it has to be fitted properly. Without proper fitting, contaminated air can enter through the sides of the mask and the nurse or whomever is wearing the mask can become infected. Here is a one-way valve that allows exhalation to exit the mask. Here we have the negative pressure room that we recently discussed. The negative pressure room is an isolation technique and is reliable and is a reliable way to fight airborne epidemics. Here's a photo of the N95 mask. This mask will be given to you by your healthcare facility because it has to be specially fitted for each individual's face. If not correctly fitted, it allows contaminated air to enter through any openings, and this will cause the person wearing the mask or the nurse to become infected. Here is a one-way valve that allows for the exhalation so the mask won't become hot and sweaty. Now we will discuss the negative pressure room. Here's a photo demonstrating how the negative pressure room works. The negative pressure room is an isolation technique and a reliable way to fight airborne epidemics. These epidemics include TB, also known as tuberculosis, SARS, and influenza. The negative pressure room has a ventilation system which allows air to flow in the room but does not allow the air to escape the room. This prevents the contaminated air from reaching other patients within the healthcare facility. And here we see the air entering through here and exiting out, but is not allowed to exit to where the other patients are staying. Another type of precaution we will be discussing is contact precautions. Contact precautions applies to diseases transmitted through direct contact with patients' skin and or infectious substances by indirect contact with patient's environment. Gloves, gown, and mask should be worn in all cases. Masks should be worn especially in cases where substances or bodily fluids can splash into the nurse's face. Some diseases requiring contact precautions are C. difficile, lice, scabies, and infectious wounds with positive cultures for MRSA, also known as staph.
The next type of precaution we will be talking about is reverse isolation. Reverse isolation is utilized when the patient has a compromised or suppressed immune system. This increases the patient's risk and makes them highly susceptible to infection. A patient in reverse isolation should be placed in a private room. Reverse isolation is effective in the majority of circumstances, especially when it is accompanied by good hand washing. Next, we will give the class an example of an interview that should be conducted when you have a patient in reverse isolation. Some things that you want to take into consideration is the patient's psychosocial needs. We do not want the patient to feel like we're isolating them. Instead, we want to let them know that we're trying to prevent them from the spread of infection.
Hello, my name is Nicole Brady, and today I will be your admission nurse. Can you tell me your name?
My name is Dorothy Carter.
Hello, Miss Carter. Do you mind giving us a medical history?
About 8 months ago, I was diagnosed with breast cancer.
And how have you been feeling lately?
Lately, I've been feeling better, but for a while, I was kind of sick during my first part of my chemo.
I'm sorry to hear that, but during your hospital stay at our facility, we will do our best to make you as comfortable as possible. And now I will give you some instructions because I don't want you to feel alarmed when nurses, staff, and your visitors enter the room. Outside your door, we have a personal protective equipment box that will allow any nurses, patients, or visitors to don themselves with a gown, gloves, and mask. This is to prevent any infection from entering your body due to your weak immune system at the moment because of your chemo treatment. Do you have any questions?
No, I don't.
And make sure that anytime you sneeze, always wash your hands to prevent any spread of infection, okay?
Okay.
And call us, here's your call bell, and call us if you have any questions. The nurse will be in to get your vitals and get you set up for your chemo treatment in a moment.
Okay, thank you.
Okay, yes ma'am. Standard precautions apply to all patients receiving care in a healthcare setting, regardless of their diagnosis. Healthcare professionals should assume that every person in the hospital is potentially infected with an organism that can be transmitted. It is very important to use hand washing. For example, Fluid remains on the hands for up to 5 minutes after contamination, and it remains on the surface for up to 2 days. This includes computers, desks, and any object used in the healthcare setting. Now we will show a diagram. Here's a diagram showing the correct hand washing technique. First, we will turn on the water faucet and wet our hands with water. Next, we will apply soap to cover all surfaces of the hand. Rub the hands palm to palm. Then rub the back of each hand with each palm of the other. Rub the palm with fingers interlaced. Rub with the back of the fingers to opposing palms. Rub each thumb clasped in the opposite hand. Rub tips of fingers in the opposite palm. Rub each wrist with opposite hand. Rinse hands with water. Dry hands thoroughly. Once dry, your hands are safe. It is important to remember to never touch the faucet again to turn off the water. Always use the paper towel provided to turn off the faucet. When a sink is not readily available, it is safe to use hand sanitizer. This comes in a gel or foam form. When a sink is not available, hand sanitizer can be used, and it will be the same technique as with the hand washing, except minus the water. First, we will apply a generous amount of hand sanitizer. Rub it between our palms, the back of each hand. Interlace our fingers. Rub our fingers, each thumb, and the wrist. And we're going to continue to rub in till totally and completely dry. When dry, we know that our hand sanitizer process is complete.
We'll be demonstrating the proper hand washing technique. First, you want to turn on your water. Check the water for appropriate temperature. Apply soap. You're going to wash each palm. Interlace fingers. Clean the outside. Include cleaning your nails. Also wash the wrist area. You want to rinse off soap with your hands pointing downward. Then you want to thoroughly dry your hands using a paper towel. Then to prevent the spread of other germs, you can turn off your water with an additional paper towel.
All medical equipment should be cleaned before and after each use. This includes stethoscopes, blood pressure cuffs, and also you should clean your areas such as computer desks, computers, and the mouse. This will prevent the transmission of any infection to reach any other patient. Now Crystal will demonstrate the proper technique of cleaning her stethoscope before entering the room of her patient.
I'm just going to clean using a basic alcohol wipe. I'm going to don my PPE because I'll be listening to the breath sounds of my cancer patient who is immunosuppressed. I will put on my gown first. And then my mask.
Come in.
Hello, Miss Carter. My name is Crystal. I'm going to listen to your breath sounds before we start your chemo treatment, okay?
Okay.
Deep breath. In and out. Deep breath. Deep breath. Deep breath. Are you feeling okay, Miss Dorothy?
Yes, I am.
Okay, Nicole will be in shortly with your chemo treatment.
Thank you.
Personal protective equipment, also known as PPE, includes gowns, gloves, and masks. Depending on the severity, sometimes you may utilize shoe covers. These items should be available on the nursing units. Gloves should be located in every patient's room. Types of PPE that should be utilized should be placed on front of your patient's door. In this instance, this is someone that's on contact precautions. We have a red stop sign to alert all visitors and staff that they need to report to the nursing station before entering. Another thing that you want to do when you have someone in contact precautions, you want to wash your hands when you enter and leave the room. You want to put on gloves and a gown if you're going to potentially be in contact with the patient or contaminated surfaces or equipment. Now we will be talking about some key points on PPE. Done before contact with the patient, generally before entering the room. The proper sequence for donning PPE. You want to place on your gown first after washing your hands. Next, you want to place on your mask. Lastly, you don bilateral gloves. You want to use your PPE carefully to prevent the spread of infection and contamination. When you remove PPE, you want to remove and discard carefully, either at the doorway or immediately outside of the door.
In conclusion, I Isolation precautions are very important to the healthcare setting to prevent healthcare workers from catching any type of pathogens, and standard precautions are important in the prevention of healthcare workers from pathogens as well.
Proper hand washing is a simple and an effective approach to prevent the spread of infection. You want to wear your PPE according to the level of anticipated contamination.